Freestanding emergency rooms. More than 200 of them have popped up in retail locations across Texas. And lots of people confuse them with urgent care, but it's not the same. Urgent care is like going to see your family doctor and they bill you at family doctor prices. Freestanding ERs are like going to the hospital and they bill you at much higher hospital prices. So is this trend of freestanding ERs, is it good for Texas?
My name is Jeff Rutledge. I'm here because I got a balanced or surprised bill from an ER when I went in.
The freestanding ER told Jeff they accepted his insurance even though his insurance company was not in network. He ended up with a $12,000 bill and the insurance company paid $215.
What these companies are doing is they're basically just going after the people that need help the most vulnerable people, the poor people, the people that are out of network are the ones that are getting stuck with these giant, outrageous bills that they never agreed to.
This year, Texas lawmakers passed 4 laws to rein in freestanding ERs. One of them limits surprise bills, like the one Jeff got. Another stops the practice of misleading patients about insurance coverage. But even with the changes, depending on your insurance coverage and out-of-network costs, some patients will still pay more than they expected. I went to the offices of Blue Cross Blue Shield of Texas. Dr. Paul Hain is the chief medical officer.
The concept of the freestanding ER, do you think it's good for Texas?
So far, the way it's been rolled out, it has not been good for Texas. What we've seen is a massive increase in the price of care and people being fooled into paying way too much.
He's talking about this study in the Annals of Emergency Medicine. It found the most common problems they treat are things like upper respiratory infections, sprains and strains, and stomach aches. Things that cost less to treat at urgent care. That's because the price per visit at a freestanding ER in Texas is $2,199, and urgent care is only $168. This study has been criticized because the raw data was provided by Blue Cross, which opposes freestanding ERs.
So it's the same care, but in a freestanding emergency room, it's at 10 times the cost.
Why does it cost 10 times more?
Well, it costs that much because they've decided to charge that much.
Blue Cross is out of network with all freestanding ERs. They believe they're overpriced and drive up the costs for everyone. But that means its customers can be exposed to enormous bills.
There's this thing called a facility fee that an ER is allowed to charge, which just means when you walk in, we get to charge you several $1,000s for walking in as part of maintaining our overhead, which urgent cares don't do. So just by crossing the threshold, it can be $3,000 before anything happens to you.
And people don't know walking in the door costs them $3,000.
Not at all, not at all.
I got a list of all the freestanding ERs in North Texas, then plotted them on a map and overlaid census data for income level. The darker green areas are the more affluent zip codes, and that's where most of these ERs are located. For example, in Frisco, there are 5 of them promoting shorter wait times and comfortable spaces.
A little bit more quiet environment, a little bit more time with the patient.
Dr. Paul Kivala is Chief Strategic Officer with a chain called Code 3 Emergency Room.
The great thing that freestands have done is they've upped the ante for the hospitals. Before, when they were the only game in town, how long did you wait at the emergency department? A lot of times the wait times, even in downtown and suburban Houston, were 8 hours, 10 hours, because they were the only game in town. And so I think, what we've done here is we've upped and improved the quality of care.
Through competition?
Through competition.
Code 3 is 2 miles away from a Baylor Scott and White hospital where, according to a project called ER Weight Watcher, patients are seen by a doctor in about 12 minutes. And that may not be because of the added competition of freestanding ERs. This study in the American Journal of Emergency Medicine found freestanding emergency departments in Texas do not alleviate congestion in hospital-based emergency departments. But what makes Code 3 different from some others in the industry is that it also has a less expensive urgent care clinic under the same roof, so patients can decide for themselves where they want to be treated.
We think we developed something that is patient-centric, and we designed this from the patient's perspective rather than from anybody else's perspective.
Should all these freestanding ERs have both?
We believe the best model is the hybrid.
I learned that freestanding ERs give Texans more access to emergency care, shorter wait times, comfortable surroundings, and some of them even offer urgent care. But on the other hand, The legislature had to step in to regulate them. The most common problems can be treated for less money, and competition has not improved hospital wait times. So are freestanding ERs good for Texas? They could be one day, but right now they create more problems than they solve. If you've got something you want verified, send me an email.